I am I am really always impressed, continuously more and more impressed with NCHSE and all of the members being dedicated to health career, health science education, because that was not something that I had any exposure to, and I accidentally found pharmacy as a career. And hopefully we can change that together. I think it would be really exciting to talk about pharmacy as a career, whether you want to be a pharmacist or a pharmacy technician, in really all levels of education. So with that, I'm the director of professional affairs here at PTCB. So that means my stakeholder group is employers that either require or advocate for PTCB certification, um, and also educators of pharmacy technicians. And I also serve as the director of PTEC, which is PTCB's newest division. It's the Pharmacy Technician Educators Council. That is a membership association that caters to pharmacy technician educators and trainers. So I'll talk a little bit more about that here in a few slides. First, I wanted to touch on what PTCB is, who PTCB is. So we were founded in 1995 by all of the nation's pharmacy associations at the time. So the American Pharmacists Association and the American Society of Health System Pharmacists. There were two exams given in states, Michigan and Illinois, who had competing certification exams for pharmacy technicians. They came together with their respective parent companies and said, let's make this national because there are people outside of our states taking these exams. And it kind of created the first standardized certification for pharmacy technicians. So we are very excited to be celebrating 30 years this year. Actually, January 30th was our 30th birthday, if you will. So 30 years of impact, and we actually just surpassed over 300,000 actively certified pharmacy technicians. So one thing I excluded from my slides is a little bit of BLS data, Bureau of Labor Statistics, because that stuff's pretty readily available. But there are about 420,000 pharmacy people working as pharmacy technicians around the United States. So having 300,000 of those is excellent. Certification is not required in every state. There's no national standard to work as a pharmacy technician. So that means that pharmacy technician certification is often voluntary, which is great to know that so many people are dedicated to earning that professional certification. PTCB is a nonprofit organization. We are dedicated solely to the pharmacy profession, being governed by all of the pharmacy organizations in the United States. So this is our mission, advancing medication safety, and then our vision, setting the standard for credentialing of pharmacy technicians that ultimately improves medication safety and patient care. So more about PTCB by the numbers. Since 1995, there have been over 840,000 pharmacy technician certifications granted. So we're really kind of rapidly approaching 1 million. I can't wait to see that number up there. As I mentioned, 300,000 active certified pharmacy technicians. We also have an advanced certification for pharmacy technicians, which I'll talk more about here in a bit, but we have over 2,000 of those. We have a sterile compounding certification, and that is earned on top of the CPHT credential. And we have about 1,600 of those. And then we have a suite of 11 assessment-based certificate programs that PTCB certified pharmacy technicians can earn that count toward their CPHT advanced. And we've administered over 14,000 of those assessment-based certificates. I'll focus mostly on the pharmacy technician certification exam. That is a mouthful, so I'll say PTCE, which is also kind of a mouthful and sounds just like PTCB, but PTCE is the exam, PTCB is the organization. So candidates are required to, in order to earn CPHT, candidates are required to pass the PTCE to earn the PTCB CPHT credential. There are two eligibility pathways to be eligible to sit for the exam. The first one is completing a PTCB recognized education or training program. And the second is having equivalent work experience, 500 hours working as a pharmacy technician. Both of the knowledge areas are similar, or they're identical for each of these pathways, and they closely align with what we test on. So our knowledge outline is covered in the recognized training program, and also the candidate attests to learning that on the job through their 500 hours of work experience. I do want to call out and repeat that it is one of the two of these. It's not both of them or any combination of the two. It's either education completion or 500 hours of work experience. And the candidate does get to choose that whenever they're applying. There are 4 knowledge areas on the PTCE. Medications make up 40% of that. Federal requirements make up 13%. Patient safety and quality assurance make up 26%. And order entry and processing make up 21%. This is further broken down into subdomains for each of these areas. And the full content outline is available at ptcb.org/credentials. And then you click on CPHT, but you will have access to this recording and also a PDF of these slides so that you can have kind of a shortcut to where that goes. Because 40% in medications is quite a big chunk, but you'll see it's broken down a little bit more digestible on the subdomains. PTCE quick facts. One thing that I completely forgot to leave off of here is a question that Nancy, you asked me. So the cost of the exam is $129. That's per candidate if your school is paying for it or if a candidate pays on their own. So $129, even though it's not listed on the slide, I'll make sure that that's also included in any of the materials. And I also wanted to say that we're proud to say that that price has not changed in almost the entire existence of PTCB. So we were able to keep that $129 price since the 90s, which is amazing. This first quick fact is something that comes to a surprise to a lot of educators. There is no minimum age requirement to sit for our exam. Our eligibility requirements are completion of a training program or having that 500 hours work experience. So there is a caveat here. Your state might put a regulation for pharmacy technicians to be working in the state. They might have an age requirement, background check, registration or licensure, that type of thing. But that doesn't exclude your students from sitting for the exam. So basically what they can do is sit for the exam, and then once they do turn 18, they can register with the state. They'll already have that certification, and if certification is required in your state, they'll already meet one of the requirements that the State Board of Pharmacy has in place. The PTCE is accessible to all who are eligible. We offer in-person testing at all Pearson VUE professional testing centers, and we also have online proctoring available. Online proctoring is a really secure environment. Personally, I don't think I could do an online test because you have to kind of be in a room all by yourself, no distractions, a clean desk, stuff like that. So I would prefer to go to a testing center, but we realize that that's not always going to be feasible for everyone. So we do offer the option for online proctored exams. Those proctors are still Pearson proctors. It's just live remote proctoring is what they call it. The exam is 90 questions. There are 80 scored questions and 10 unscored questions. Those 10 unscored questions are pretty standard in certification exams. That's just kind of testing to make sure that our knowledge areas are covering what pharmacy technicians are doing in the workplace and what they're getting educated and trained on. The exam's 2 hours, and it's broken apart into a 5-minute tutorial, 1 hour and 50-minute exam, and a 5-minute post-exam survey. And the number one question I hear when I interact with folks at NCHSE is, can we implement pharmacy technician into our health science programs or at my school? And yes, the answer is yes, you can offer a pharmacy technician training program at your school. It's relatively simple. You have quite a few options for your school. There's CPHT knowledge requirements. That's how a program becomes recognized. So the students meet that first eligibility option. You can create your own curriculum, or you can use a third-party curriculum provider. I believe you'll have Wednesday webinars from a few of the other NCHSE resource providers out there that do offer pharmacy technician education and training. So make sure you tune into those as well to learn more about the curriculum provider part of it, because PTCB as a certification organization does not develop any type of curriculum. In order to get recognized, it's the program director just doing an annual attestation. So that's done on a yearly basis, just to say that you meet the knowledge requirements outlined in the CPHT knowledge requirements, which I'll give a shortcut to here in a second. But I did want to point out that recognition, to be recognized for your school to be recognized by PTCB, it's completely free. It's a relatively simple attestation process, and PTCB does not charge for that for your school to be recognized. There is an extremely low barrier of entry to the profession whenever candidates are certified or working towards certification. So I say that, and you'll see there's a little asterisk here. That is because state boards of pharmacy do often put in regulations that might not permit your students to work as pharmacy technicians because there's either an age requirement. That's usually the number one thing, is the State Board of Pharmacy requires pharmacy technicians who are registered or licensed in that state to be 18 years of age. But again, that doesn't exclude them from sitting for our exam in advance of them leaving your classrooms. They can leave with that certification, and that serves as, like I mentioned before, one pathway to state licensure or registration, which is really beneficial. If you'd like to, you could scan this QR code. This is the knowledge requirements document that I was referencing, that a program director attests to meeting all of those requirements in order to get recognized by PTCB. And again, you'll have access to these slides and either a PDF handout, or that you can access this from the recording. The number two question that I receive in conversations with NCHSE members and the Health Science Conference attendees is, how do my students prepare to take the exam? We often hear, there is another certification exam out there, and that test is easier, which we have a higher national pass rate, which is 70%. And we also hear that certification organization offers better preparation materials. And I think that might be because our preparation materials are still relatively new. We have something pretty much brand new. It's called the Practice Bank. This is made up of 300 former PTCE questions for real exam practice. So you get that, the students get that feeling of how the PTCE is constructed and how the questions are asked. And it also includes access to 400 digital flashcards that covers drug facts, terminology, and other essential pharmacy knowledge. The candidates can switch between study questions and the study deck. The study deck are the flashcards, and the study questions are the practice exam questions. And it can be customized by study length, how difficult they want the questions to be, and even choose between time or untimed sessions. And there is an added benefit to this. If your school or school district purchases these in bulk, it gives you access to an admin panel that you can build the practice exam questions based on, for example, the unit you're covering. You can do just federal requirements and then quiz your students using the practice bank, which is made up of retired PTCE questions. They are retired questions. They are all still valid questions. It's just standard for us to remove them from our exam forms. I want to call that out because federal requirements change. We're not going to put anything out there that has incorrect information for candidates to have access to wrong information that they might never be tested on. So that's a really convenient tool. It's a 90-day subscription. It is $65 per student if they pay on their own, and we have discounts if your school or school districts pay for that in bulk. We do offer a 10% per student discount. In addition to the practice bank, we have a pre-PTCE. So this is also relatively new. We've always had a practice exam, but this is the pre-PTCE, and we're seeing candidates who complete the practice bank subscription and then sit for the pre-PTCE who have an expected result of passing the pre-PTCE have a greater success rate on the PTCE itself. So this is also built with retired PTCE questions, and it provides an authentic testing experience. So it doesn't require a student to go to a testing center, but it does lock their computer screen down. It's timed. They can go through it and flag questions just like they could on the PTCE itself. And what's really convenient too is they get an explanation for why each of the incorrect answers is incorrect. And then there is instant feedback with that. And also there's a new detailed score report for each of the candidates that kind of assesses their competency level in each of the knowledge areas. So you as an educator could sit down with your student, look at that report, and then kind of do any kind of remediation on the certain knowledge areas if they are below the competency to pass the exam. This is $29 per candidate to purchase the pre-PTCE. We offer a $10 discount per voucher if your school district purchases it. So it's $19. It would cost your school or school district $19 to purchase that per student. There's no minimum. So once a student passes the exam, some CPHT quick facts. Recertification is every 2 years. It's $55 to recertify, and that's earned by completing 20 hours of pharmacy technician specific continuing education. One of those hours has to be in patient safety, patient or medication safety, and the other has to be an hour in pharmacy law. And I do want to say there is a little caveat here too, state registration and licensure. They often mimic this formula, but there might be additional requirements by the State Board of Pharmacy to maintain registration or licensure. So as you know, certification is separate from registration and licensure. And this is the fun part. Working as a pharmacy technician, because there's a low barrier of entry to the profession, has the ability to give exposure to nearly every aspect of healthcare. This is just one example of how being PTCB certified ties into working with a pharmacist, working directly with a patient in nursing at physicians' offices, and then working with other pharmacy personnel such as assistant or clerks. But there are pharmacy technicians working everywhere. It's not just at your local drugstores. As I mentioned earlier on the presentation, with my experience as a certified pharmacy technician, I was making IVs. Like, I was a certified pharmacy technician and I did not have training other than what my employer provided me. So I was actually in a hospital making IVs. Part of that really fun part of this was I got to go on rounds with our pharmacy residents and our pharmacists to kind of see how my work in the IV room was then administered to the patient. And I got to see their disease states and just understand from the physician and the pharmacist conversations what the medicines were treating and how my work was impacting individual patient care, which I think is really important, especially going back to that low barrier of entry to the profession and having that exposure. So we get a ton of questions like, my students want to become pharmacists. That is wonderful. You can work as a pharmacy technician on the path to becoming pharmacists. In fact, I just learned yesterday that over half of accepted PharmD students have paid pharmacy technician experience. So not only does working as a certified pharmacy technician provide that exposure to all healthcare careers, it also, if they do want to commit to pharmacy, they can, hold on, I think my phone is ringing. Sorry about that. I hope you can't hear that. No? Okay. I'll try to talk over it. Sorry about that. The exposure to working in a pharmacy offers all of that wonderful ability and also a pathway to become a pharmacist or a pharmacy student. But I am a testament that you can be a career pharmacy technician. And then also with advancement opportunities to tack on and stack those assessment-based certificates that I talked about, um, really is important for those who do want to be a certified pharmacy technician as a career, because it is a viable career option now, which I still think is rather new. We're kind of in this phase with the entire pharmacy profession to talk about the pharmacy profession, getting students interested in becoming not just becoming a pharmacist, not just becoming a pharmacy technician, but there's so many other opportunities within pharmacy. They could go into research and things like that. So I mentioned advancement opportunities. PTCB has 3 certifications. I spoke mostly about CPHT because that is the initial entry level certification credential. I did mention CSPT and CPHT Advanced. Those are more specialized, as I mentioned, but this is just to demonstrate the ability for your students to advance with their PTCB certification. CSPT has its own eligibility requirements. It does require work experience. So somebody working in an IV room, forming sterile compounding procedures could be eligible for that. And then CPHT Advanced is a little bit different. That's earned by choosing from that suite of 11 assessment-based certificates. 4 of them will provide them with the opportunity for CPHT Advanced. Renewal for that looks a little bit different. It's still only $55 to renew every 2 years. They just have to earn 5 additional CE hours. So also, that one of the most important questions that we get is why should my students choose PTCB? PTCB released a workforce study recently that PTCB certified pharmacy technicians are more satisfied and more willing to stay in their job. Oftentimes, PTCB certification is called out as required or will be required within a certain amount of time, even if a student has an accept NHA certification. That might get them through the door, but in order to advance through the career ladder or career lattice at that employer, PTCB certification may be required. And that's because we're seeing a lot of employers start to build in those assessment-based certificates and CPHT Advanced and CSPT certification as pathways for pharmacy technicians to commit to their career as pharmacy technicians. So there's a career ladder, career lattices, things like that. There is a trust that comes along with PTCB certification, mostly because PTCB was founded by the profession for the profession. That's the only certification we do. We only operate in pharmacy. The any PTCB is being a nonprofit, all of our revenue goes right back into the pharmacy profession. So we're really committed to that. I mentioned career growth opportunities. PTCB, again, with the mission and vision dedicated to patient safety like nothing else, and the mission-driven nonprofit dedicated to the profession. The last bit I want to talk about is PTEC. I did mention this is PTCB's newest division, and this is a volunteer organization with a similar mission that unites, supports, empowers educators in the education and training of pharmacy technicians. And together our PTCB and PTEC assist the pharmacy profession in educating and training pharmacy technicians to adhere to best professional practices and promote the pharmacy technician's profession through professional activities. PTEC, actually, we have our own conference that is focused just on pharmacy technician education and training. So if you want more information, there is the QR code you can scan to get more information, including how to register. We do have a schedule at a glance. The programming isn't solidified yet, but it is in Columbus, Ohio, July 10th through 12th. At the Hyatt Regency downtown. And the theme for this year is building the next generation of pharmacy technicians. I think it's a wonderful time. I alluded to this earlier, but the pharmacy profession is really committed to having folks learn early on in their education about careers in pharmacy. Like I mentioned, research, becoming a pharmacist, but also pharmacy technician and pharmacy technician education. As we advance conversation, pharmacy technician education should probably standardize. And I would like one day to see a national standard for that, much like NCHSE has health science standards. It would be wonderful to have one standard for all states for pharmacy technician education and training. So if you're interested in learning more about the conference, that is the QR code. And then that is the end of my presentation. So I'm very happy to take any questions, comments, concerns. Uh, if you don't want to ask them out loud, you can email me. That is a QR code that will allow you to save my contact information or send me an email.
We did have a couple of questions or some questions, some comments. Do you know if pharmacy schools require or recommend students to have pharmacy tech before admission?
From an admission standpoint, it's not that it's never in an it's not like the rubric to say like that, you have to have pharmacy technician
Mhm.
experience or any kind of pharmacy experience. But with just learning, like I said yesterday, over half of accepted PharmD, which is the doctor of pharmacy, students have paid pharmacy technician experience. I think it does make you an overall better candidate to have experience in what you're committing to as a career. And because it's relatively easy to get that experience as well, I think it would just make an applicant a better candidate.
Yeah. Um, Doris said PTCB certification has allowed many of her students who move out of state to be able to quickly get licensed in another state. So that's pretty
Yeah.
exciting, especially in California.
Yeah, that is a very that's what's great about the CPHT credential is we're not affiliated with any board of pharmacy, even though we do have the word board in our name. We're a certification board, but that means the certification is transferable. So if I earn my certification in Ohio, I can go work in California because the board recognizes that PTCB certification.
Are there any? I didn't see anything else in the chat. Are there any other questions that anyone would like to put in the chat or unmute and share?
Um, Melissa, if it's okay, I'm afraid this person may get off
Yeah.
before we get to it, but I do see that one person called in, and you're at the area code 334. So if you're interested in the certificate of participation for 1 hour of professional development, if you'll just email us at hello@healthscienceconsortium.org, we can add you to the list. And or you can put your email in the chat, but I didn't know if you could. You might be on your phone going down the road. So just wanted to offer you that. Thanks,
Yeah.
Melissa.
Yep.
And-
Everyone else, you don't need to worry. We have your information. We're
Yeah,
worried about the call in.
right. And I wanted to call out and embarrass our board chair for NCHSE, Angel. Wave at everybody. So Angel Clark just assumed the role as board chair for NCHSE. She is currently the health science state leader in South Carolina, but she also has in her resume, Zach, and she's probably shared this with you before, that she was a pharmacy technician along with her many other careers. So Angel, you want to tell us like what kind of setting you worked in as a pharmacy technician?
I worked in two different settings. I started out in the hospital setting, and then after the hospital setting, I never did the what do you call it? The pharmacy, the regular pharmacy that you pick your prescriptions up at. But
Yeah.
I did prison pharmacy. So
Oh,
that was very interesting. But so hospital pharmacy and prison pharmacy, which was very similar, they just didn't pay for their drugs.
Yeah, I like it.
Yeah.
Um, um, I lost my train of thought for a moment, but I will say that my daughter, 20 years ago, sat for the PTCB and as a high school senior, and to kind of go along with Melissa's question about is it required that students be pharmacy technicians when they are submitting an application for the professional school of pharmacy? And I know in her case, there were lots of applicants that particular year for the professional level of pharmacy, and I really think that she had a competitive edge because she had been a pharmacy technician for 2 years, and as a selection committee filtered through all those applications, they could see that perhaps she was serious about this from the beginning. And I know that there was another girl with a similar GPA as her. She didn't get admitted the first round, but Trish did. And so I do think it does give students a competitive edge if they're looking to continue up the ladder of pharmacy. So I wanted to add that.
I agree because at my time at hospital pharmacy, I did a lot of different things. I did pre-packaging, I did home health packaging, I did chemo preparations, hyperalimentations, all types of things, PO specials, you name it, we did it. And that was
Yeah.
at Richland Prisma. So
Yeah.
yeah.
I always hear that the nursing schools require CNA to get in, but I hadn't really heard, and I want to be sure I give my students just good, accurate information to know where they need to go. I do know we have one of our students just got, we'll call it work-based learning at a pharmacy here in the town. I live in a small town, and she is not a pharmacy tech. She has already, I think she's making really good money. She's already advanced within that local drugstore, but I have told her, I don't know that she has really thought pharmacy. She was thinking more forensics, I think. But I've tried to encourage her. Pharmacy is an excellent way for you to go. You enjoy working at in that office and you're advancing already. Why not pursue that certification? Because it's gonna help you.
I remembered what I said. I lost my train of thought, and Zach said it, and then you just said it. But isn't it funny how we call them drugstores? You know, I
Yeah,
just
there,
think
there you go.
the drugstore.
Well, it is foster drug.
Yeah,
It's
I
the drug.
mean, it's just a
Only one.
throwback term, right? We still use it. I just think it's cute. I had to say that. And I know you'll want to close out, Melissa, but Zach, you are an excellent presenter. You really are. Very organized and
Thanks.
great information. So thank you for, I could stop the recording, right? We don't have to know all, but anyway, thank you so much. So Melissa, I'll turn it back over to you.
Yes, thank you so much for being here, Zach, and